Have you ever wondered what loss of cervical lordosis really means? It refers to the flattening or reversal of the natural inward curve in your neck. This curve supports your head's weight, protects nerve roots, and prevents vertebrae from grinding together. When the cervical curve flattens, weight distribution shifts. Your head moves forward. This leads to muscle strain and compresses discs that weren't meant to handle such pressure. This condition is often called military neck, straightening of the cervical spine, or text neck. Identifying this issue can be tricky. Many people feel no symptoms at first but may experience chronic neck pain or tension headaches. Numbness in the arms and hands could indicate nerve involvement. When the curve flattens, nerve root openings narrow, leading to pressure and pain. If left uncorrected, the spine undergoes structural changes. Discs may narrow, and bone spurs develop. Abnormal alignment contributes to degenerative changes over time. A mild curve loss at a younger age can worsen as you get older. So, can chiropractic care really help? Yes, especially with a focused approach. Standard chiropractic care alleviates pain and improves mobility, but correcting the curve requires targeted structural rehabilitation. Dr. Brockway implements a corrective care program aimed at restoring cervical curves. This program involves spinal adjustments, extension traction, and the use of a Denneroll cervical orthotic. Each component plays a critical role in restoring the curve. Together, they work to achieve lasting structural improvement. At Glendale Chiropractic, the program is structured in phases. The initial phase reduces pain and muscle tension before structural corrections start. After that, cervical traction therapy gradually restores the curve, supported by the orthotic and adjustments. The entire process can take 3 to 12 months, depending on individual circumstances. Consistency is crucial for effective results. Patients who adhere to the protocol generally see better structural progress. Your journey begins with a structural evaluation. The first visit focuses on gathering information and imaging, if needed. X-rays often provide essential insights into your curve's current angle. Following this assessment, a tailored care plan is developed. Are you ready to take the first step towards proper cervical curve restoration in Denver? Visit Glendale Chiropractic at 425 S Cherry Street, Suite 307, or call 720-889-1659 to schedule your evaluation today.